नमस्ते सर।
हाँ नमस्ते नमस्ते सर।
नमस्ते सर, नमस्कार।
बस सर नमस्कार।
नमस्ते सर। नमस्ते।
नमस्कार खांडे सर। नमस्कार।
नमस्ते।
नमस्कार नमस्कार।
Dr. M.B. Gururaj sir, are you there?
Namaste.
Namaskar, ma'am. Yes sir, we shall be starting sir. I'll be introducing first sir, then the lecture will be beginning. So a very good afternoon to respected dignitaries, governing body members of RAV, Director Ma'am RAV Dr. Vanasiruha, Gurujanas. I welcome you all in another intellectual session of Gyan Ganga webinar series. Today's guest speaker is Dr. M.B. Gururaja sir, who have joined us today in the 205th episode of this knowledge voyage. I, Dr. Jitika Duggal, on behalf of RAV, welcome you all for today's session. On the onset, we would also like to express our heartfelt gratitude and welcome our mentors who have always been there to guide, motivate, and encourage us for sustenance of this series. Respected Padma Bhushan Vaidya Devita Trigunaji, President of Governing Body Member RAV. Respected Vaidya Rajesh Kotecha Sir, Secretary Ministry of Ayush. Respected Dr. Vanasura Ma'am, Director RAV. Now let us begin the session by seeking the blessings of Lord Dhanvantari. Namami Dhanvantari Adidevam Surasudevam Vidipadapadmam Loke Jararuk Bhayamityunasham Dhataramisham Vividoshadhina. Om Dhanvantarayana. Moving forward, now I would like to introduce today's expert, Dr. M.B. Gururaja sir, who is going to throw light on management of KAMALA and KUMBHA through Ayurveda protocol. Sir has done BMS from Bangalore University in 1995, MD from National Institute of Ayurveda, Jaipur in year 1998. Sir has professional experience of nearly 3 decades and sir expertise in holistic view of disease management, drug standardization, lifestyle management consultancy, Ayurvedic management, liver disorders, skin diseases, infertility, joint disorders, and gynecological. There has been in various eminent roles in our fraternity. RAV Guru Rashtriya Ayurveda Vidyapeeth as Ministry of Ayush in Delhi, as ex-member Executive Committee Karnataka Ayurveda Medical College Principals Forum. Sir has been Medical Advisor Pentacare Ayurpharma Bangalore. Sir has been President NIMA Nima Shivamogga District Branch, Honorary President AFI Shivamogga Branch. Sir is currently Chief Consultant at Dhaval Pentacare Ayurveda Chikitsa Kendra Shivamogga. In past 24 years of medical service, over 50,000 patients treated through Ayurveda. Sir has attended several state level and national level conference workshop as participant, guest speaker, resource person, co-chairperson, and chairperson. There is also several clinical studies published in renowned journals. Now, I would like to invite Dr. M.B. Gururaja sir to proceed with the lecture. Sir, please, sir, we can continue.
Shall I start now?
Yes, sir, please start.
Hope the screen is visible.
It's clearly visible, sir. Voice is also audible.
Okay, thank you. At this outset, let me first thank the Ministry of Ayush as well as the governing body of Rashtriya Ayurveda Vidyapeeth and Director Madam, and even my gurus and senior gurus of RAV. Today, I will be going through a presentation wherein the management of KAMALA and KUMBHA, which I usually practice in my hospital, And regarding that practical utility and the results or outcomes of the cases, I'm going to discuss. We all know that liver is a very important organ in our body, and it is a Moolasthana for Shodhitavashrotas, and it is one of the largest gland, and it produces a lot of functions in the body, and is very vital to human survival. So along with that, Yकृt, pleha is also one of the important organ of reticuloendothelial system, and it is a Shonitavashrato Moolasthana. And this Moolasthana has to be kept clean and very tidy and healthy in order to have a very good blood as well as digestive functions. We all know that Shonitavashrotas is very typical in our body, and very clearly it depends on the way we eat and the way we live that influences the Shonitavashrotas to get disturbed. So what are the things in the Shrota vitiation? Very clearly it is aharascha viharascha syadosha gunai samaha dhatubhir vigurnaschapi shrotasamcha pradushakaha. Particularly vidahi annapanani snigdoshnani dravani cha raktavahini dushanti bhajatamcha atapanalehi. So typically the ahara vihara is the one which is going to disturb the raktavashrotas, and which is the important for today's our deliberations. So we know that what are the types of Shrota vitiation and what will happen if something wrong goes to the or even injury occurs to Raktavashrotas. So what are the Rakta Pradoshri Vikaras? Very clearly it is said that Pakshante Raktadoshajaha Kusta Visarpa Pidaka Rakta Pitta Asrugdara Guda Medra Asyapakascha Pliha Gulmotta Vidradihi Nilika Kamala Vyanga Viplava Stirakalakaha Dadrus Charmadala Shmitram Pama Kotasra Mandalam. So all these, if you categorize it, very typically the Pliha and Kamala related two things are from the liver and the spleen areas, and most of the other things are related to skin conditions, except Asirubdara is one of the things which is from the adho of the body. So otherwise, most of them are related to the skin conditions. So it is typically the liver which is very keen in manifestation of many of the skin disorders. So we know that line of treatment in Raktapradoshya Vikaras, Kuriyat, Shonita Rogeshu, Rakta Pitta Hari Kriya, Vireka Upavasa Shamanam, Shonita Siddha. So very typically, Virechana is the one which is very vital in the management of Raktavashrotas disorders. Of course, Upavasa will overcome the Vidagdha Pitta, and Rakta Mokshana is one of the very important area where we can get results related with the liver disorders as well as skin diseases. So we know that what is actually the Yakrit Vikara and Ayurveda, what it says about liver disease includes a heterogeneous group of diseases of the liver and biliary system affecting more than 50% of the population, ranging from non-alcoholic fatty liver, gallstone, hepatitis to hepatocellular carcinoma. It's a wide range of diseases. Some of them are even medically manageable and some of them are surgically manageable.
Seminar.
So quite a good number of Ayurvedic liver tonics have been prescribed for chronic liver disease and GI disorders. More than 15 classical Ayurvedic formulations are very widely used, and more than 10 medical plants are widely used in Ayurveda by practitioners. Arogyavardhini Vati is the highest prescribed medicine in liver disorders. There are many gray areas in hepatobiliary disorders can be addressed through integrated research in Ayurveda. We have plenty of medication and the protocols and everything. At a few points, we may require some other system of things as a supportive thing in order to get the patient from the verge of death to bring him back. So such type of combination of integrated research, it happens in Ayurveda and allopathy, then it will be wonderful to the humanity. So we know that there is a difference between the way we understand the liver disorder as per the modern and as per the Ayurveda. And liver is the largest organ in the human body as per the modern concept, even it is there in Ayurveda, and it is one of the Kostangas as expressed by our acharyas. and it is a seat of Pachakapitta, and it is a Mula of Raktavasrotas. Just for the sake of understanding where it is, the exact anatomical location of the. And there are certain important facts about the liver. We need to have a information regarding this. The weight of the liver is around 1 to 1.5 kgs. The bilirubin production is 250 to 300 mg per day. Most of it secretes 1 to 2 liters of bile per day. So all these, if it is a background, some of the knowledge about these things, if it is there is a real physiology of the liver, then we can understand the pathology and what is the outcome if anything goes wrong. And half of the lymph flowing through the thoracic duct comes from the liver. So all these are related with that. So whenever you want to manage the lymph flow or lymphatic things, then also you have to control or strengthen the liver. So liver is a very important organ in our body. 15% of the liver cells are hepatocytes, but most of it is Kupffer cells derived from blood monocytes, which have important immunological function. They constitute the largest single mass of mononuclear phagocytosis. So anything which comes to our body and runs through along with the blood, liver is the gateway which acts as a filter, and it separates all those phagocytic activities for that purpose, and all damaged blood cells, everything will be separated, and all these things will be taken care by the active healthy liver. So that's the reason even many of the viruses, antigen antibody complexes, bacteria, even endotoxins like nitrogenous waste product from the gut, which may not be allowed to enter into the systemic circulation by the active filter of the liver. We know that the yकृत or the liver performs various activities, like it maintains the metabolism of nutrients, carbohydrates, proteins, and fats, synthesis of albumin, coagulation factors and coagulation inhibitors, transferrin, hepatoglobin, hepatic enzymes, and even exogenous materials, drugs like copper, alcohol, etc. Then endogenous materials, bilirubin hormones and such other things. Then storage and particular minerals, iron, such things. It involves in many of the important activities of the body. According to Ayurveda, liver has a two important thing. That is rasaranjana, means whatever the ahara which has been taken to the human gut, it is digested and later turned into rakta. That is the uttarottara dhatu upavriddhi and dhatu vardhana krama. In that, how the rasa is converted into rakta. That is the one process. That process is controlled by yकृत. And of course, yकृत also performs a lot of ahara pachana because it's a basic abode of Pachakapitta. So what are the major manifestation of liver disorders according to modern, the presently whatever it is there, if you just broadly tabulize it, it is hemolytic jaundice, hepatocellular jaundice, cholestatic jaundice, acute hepatitis like viral hepatitis, HIV, B, C, D, E, and cytomegalovirus, Epstein-Barr virus, such other things. Then non-viral infection like leptospirosis, poisons, which also causes liver manifestations. Then chronic hepatitis, maybe because of chronic hepatitis due to HBV and HCV and HDV viruses. Alcohol, it's a very common one. Chronic hepatitis is one of the important causes, alcohol and drugs. Then there is a biliary obstructions like primary, secondary gallstones, strictures, neoplasm, and ultimately the cirrhosis. These are the manifestations as per the modern. Then according to Ayurveda, there is clearly whenever there is a disease of liver, the prominent term what we hear is KAMALA. That is Shakashita KAMALA, or it's also known as Alpapitta KAMALA. Herein we have two varieties, Swatantra KAMALA, that is hepatocellular jaundice. There is a Paratantra KAMALA, that is obstructive jaundice. Then we have Kosha Shakashita KAMALA or Bahupitta KAMALA. Once again, here it is hepatocellular jaundice and there is hemolytic jaundice. Then other than these terms of KAMALA, we have got certain other things like KUMBHA KAMALA, Halimaka, Panaki, yकृत dosha and yकृत vruddhi. Hepatomegaly and yकृत dosha is equated to sluggish liver. Panaki is equated to hepatorenal syndrome. Halimaka is one of the dangerous situations where fulminant hepatic failure, which leads to hepatic encephalopathy and coma, and death may occur. So these are some of the common terminologies which is used in Ayurveda to represent certain disease manifestations. And usually in our practice, we get people of KAMALA as well as KUMBHA KAMALA, and even up to Halimaka, Yakrut Dosha, all these diseases very commonly we find in Ayurvedic practice. So what are the etiology of liver disorders? From the modern point of view, it is simple. Alcohol, drugs, poison, viruses, gallstones, congenital reasons, neoplasm and protozoa, bacteria, etc. According to Ayurveda, it is consumption of Amla Lavana rasas in excess, Madhya Sevana, Bridbhakshana, Divasupna, Ushna Tishna Padarth Sevana, Viruddha Ahara Sevana, Asatmya Ahara Sevana, Vega Rodha, consumption of Pittakara Ahara, all these are some of the listed things, and definitely do have its importance in manifestation of Yakrit Vikaras according to Ayurveda. So in general, if we discuss about the Samprapti pathology of liver disorders, it is generally a causative factors causing a vitiation in respective dosha doshas and malas and shotas, leading to various liver disorders. But which can be from the point of practice or the treatment aspect, we can classify these liver disorders in two types as a structural disorders or functional disorders. Structural disorders like stricture, neoplasm, congenital causes, maybe like congenital biliary atresia, the congenital absence of the common bile duct or cystic duct, something like that. So functional disorders like Gilbert syndrome, Crigler-Najjar syndrome, type 1 and type 2, Dubin-Johnson syndrome, Rotar syndrome, hemolytical jaundice. So these are some of the commonest things we may have in our practice. What are the common clinical features of a liver disorder? Usually it is jaundice, yellowishness, discoloration of the skin and clear and mucous membranes. And it's eyes, anorexia, upper abdominal pain, greenish yellow colored or clay colored stool, dark yellow colored urine, pruritus, weight loss, fever, and varicose bleeding. It's not common, but usually when there is a increased portal hypertension, then there will be chances of varicose bleeding and even the gastrointestinal bleeding. Splenomegaly, hepatomegaly, ascites, it is usually a common symptom in KUMBHA KAMALA or the later avastha of KAMALA. Headache, nausea, vomiting, and diarrhea. So these commonest things will be there with liver disorders. So according to Ayurveda, KAMALA or KUMBHA KAMALA, if you observe that, what are the lakshanas? Yellowishness in sclera, skin, mucous membrane, nails, reddish yellow. Skin resembles the skin of rainy season common frog. Weakness in sense organs, burning sensation, bar itching, indigestion, general weakness, anorexia, pale clay colored stools, and protruded abdomen. So all these things, it's very common because very clearly said Haridra Netram Prisham Tvaka Haridra Anana Rakta Pita Shakrun Mutro Bekavarno Hatendriya. So very clear terminologies Ayurveda has described about the Kamala. Then Lakshanas of Yakrit Roga according to Ayurveda, like Halimaka, Lodara, Lagavaka, Alasaka, these certain terms, these terms are there. Almost mimics the Yakrit Vikara or Kamala like, but they are a little bit more where multiple organs are started involving. So wherein usually you have yellow, green or blackish yellow colored skin, nails, sclera, urine and stools, loss of strength, loss of enthusiasm, stupor, poor digestion, then mild and low grade fever, pain all over the body, burning sensation, thirst, anorexia and giddiness. So whenever there is anorexia, giddiness and all those things, they require IPD type of care. It cannot be managed over the OPD levels. Then according to Ayurveda, the Panaki is one which is having a fever, area, pale colored sclera. If such action is there, it is considered as Panaki. Then Yakrutodara, Yakrutaludara, enlargement of the abdomen, anorexia, indigestion, free fluid in peritoneum cavity, everted umbilicus, general weakness, and yellowishness all over the body. These are usually the some commonest lakshanas in KUMBHA KAMALA also. So this is some of the patients of mine. You can observe the yellowishness in the sclera, and most of them, the bilirubin levels are comparatively higher than 30 mg per deciliter. In all these cases, and most of these cases are alcoholic liver disease or parenchymal changes are there. All these cases are almost same. In this case, the bilirubin was 55, which is the highest one. 55 mg per deciliter. And how a Kumbha Kamala will look like, you can see, observe that everted umbilicus as well as a protruded belly like pot belly. So these are certain other cases. A protruded belly leading to, there will be even umbilical hernia, and sometimes when patient goes for operation of that, and even sirajala you can make out on the abdomen. And on the case on the right side, you can observe even the gynecomastia, which is very common in a chronic stage of cirrhosis. And it is very typically the umbilical hernia as well as everted umbilicus and protruded abdomen, a commonest feature in Kumbha Kamala. You can observe there, almost his body musculature has gone down because the albumin is leaked into the peritoneal cavity fluid as a free fluid. So his muscles has gone down, his muscle depots are reduced a lot. So all these are similar type of cases, but except when the young child is on the left hand side is a case anomaly. He was having what do you call them? Congenital biliary atresia, absence of common bile duct. So that's the reason he was having ascites and these type of conditions. You can observe the yellowishness in the skin, abdominal skin, and usually these patients will have typical padashota. You can see the pitting edema also. Swelling, you can observe entire length of the pada or even the lower. There is ascites has developed from the diaphragm downwards. Usually will have at the end stage of the cases. Usually will have entire body, lower body is edematous. You can see everted umbilicus. Typically, you can call it as a distension of abdomen. It is also called as a Jatodaka Avastha because there is a can manipulate or while examining the abdomen, we can find out the fluid thrill. So laboratory investigations, why we need to understand? Because there are certain areas we need to give explanation to the people and even to the scientific. We need to go for some bladder, even though we clinically we've examined and the patient has been diagnosed with certain liver disorder, but that needs to be always supported with type of typical laboratory or some screening text and all those things with the documentation. If it is there, it is always good. So what are the aims of laboratory investigations? It is to detect the hepatic abnormality, to measure its severity, to define its structural change, and to look for the specific cause of the liver disease, to know the consequence of liver disease. We need to understand what is the level of hepatic damage, what is its severity, whether it's only a functional damage or a structural damage. Then what is the specific cause of the liver, whether it is a stricture, gallbladder stone, or even the absence of the thing, or even there is a chronic change in the parenchymal tissues, or even any blockages or swelling in the hepatocytes. We need to know the specific liver disease cause. Then it will be easy for us to go for the treatment. And to know the consequence of liver disease, because they are usually in a very end stages of that, on the verge of life, they are approaching the doctor. Then it is our duty to understand that what would be the consequences of liver disease. If I take this disease, this case, if I treat it, what should be the outcome I expect, and what would be the wrong side if it is goes. So if we know the consequences, we can explain the things to the patient side as well as the attendants to go ahead with the treatment. So what are the laboratory tests usually which is performed in liver disorders? In urine, it is bile salts and bile pigments, and an entire range of liver function tests, which includes serum total bilirubin, serum direct bilirubin, serum indirect bilirubin, serum total protein, serum albumin, serum globulin, SGOT, SGPT, and serum alkaline phosphatase, GGTP. So this entire panel is called as a liver function test. Then we have serum prothrombin time. Of course, in the serological or viral test, HBsAg, HBcAg, HBeAg, like that, and DNA polymerases. depending upon the type of things what we suspect. And then after the laboratory investigation, what are the other things what we can do with this? That is called imaging techniques. So in this imaging techniques, you can go for the ultrasonography, radiography, CT, MRI, or ERCP, which will give us a very clear idea that what is the disease condition. Once again, these investigations can be repeated once the course of the treatment started. Maybe end of 1 month, maybe end of 2 months. Once again, repeat the things to observe the progress of the disease with the treatment. So that is the importance of these things. For the purpose of comparison, it is better to start with these imaging techniques and the reports and laboratory investigation reports. After that, if you start a treatment, that will be better. To arrive at a diagnosis and a differential diagnosis, a very important thing, we need to go for a very detailed history in these cases and the clinical findings. These clinical findings and history are very important and informative to help to come to a conclusion of liver disease. It is better to clinical diagnosis be followed by a lab investigation to confirm. Even though lab investigations are advanced, still has limitations, but very useful in doing differential diagnosis. For example, unconjugated hyperbilirubinemia means indirect bilirubin is more in blood without any abnormal in other LFT. So this is usually due to increased bilirubin production or defective erythropoiesis or from inability of the liver cells to transfer the bilirubin across the liver. So it is very common in case of Gilbert syndrome. Till today, I got an opportunity to treat 2 cases of Gilbert syndrome, wherein very clearly, and if you check it in the LFT, only unconjugated bilirubin will be high. Other things will be normal. So these people require less medication, and usually their lifespan will not be any disturbed. Only thing is that they should not be going for any pittakara aharas. If they increase the pittakara aharas and go out in sun and do all those things, then the color will become more prominent and it has become more yellow. So that's the only thing what we have to take care. The other one, the unconjugated hyperbilirubinemia without any other LFT abnormality with bilirubinuria is indicative of Dubin-Johnson syndrome. So it is conjugated hyperbilirubinemia means the direct bilirubin is more, but other LFT abnormality is not there. But urine also has bilirubin. So this is very common in Dubin-Johnson syndrome. So if we understand these basic critical things, definitely treating these conditions through Ayurveda would be better. We can imply or apply the concepts and principles of Ayurveda and appropriately. If with the above condition, including the abnormal left, it is there, then it is hepatobiliary disease. For example, if a very high plasma bilirubin is there, it is indicative of biliary tract obstruction. 1 point. With the sustained high values indicates neoplasm or growth. If any liver abscess is there or any carcinoma, that hepatocellular carcinoma it is there, then there will be continuous high plasma bilirubin will be there. If there is a fluctuating levels of plasma bilirubin is there, then it is maybe due to the obstruction due to gallstones. So whenever gallstone is obstructing, there will be increase in the plasma bilirubin, and when the gallstone obstruction goes off, then the plasma bilirubin levels will reduce. Similarly, if hepatic enzymes are showing multifold increase than the normal, which indicates the viral hepatitis, is very common acute hepatic damage. In this, in the last year, many of the cases we have seen when there was outbreak of hepatitis A at our place, we have seen patient with even 4,000, 3,000 like that, SGOT, SGPT values. A greatly increased plasma alkaline phosphatase activity is the main biochemical indicator of biliary obstruction, though it won't confirm the site of obstruction. So very clearly, if it is other LFTs are mildly altered, but serum plasma alkaline phosphatase is highly increased, then it is suggestive of obstruction. Sorry, this obstruction may be understood in the 2 ways. When there is a severe inflammation of the hepatocytes, then also there may be obstruction at the level of the production or the minute blocks of the liver. So thereby the hepatocytes, which are in a hexagonal shape, compress each other against each other. They're causing an obstruction into the path or bile flow. So thereby also cause obstruction. Then also we'll have that tilapistanibayastu varchaha, which is typically mimicking like obstructive jaundice or shakashita kamala. But if it is due to obstruction in the gallbladder, I mean cystic duct or common bile duct, and in that also we'll have similar type of availability of biochemical indicator, like particularly the serum plasma alkaline phosphatase will be increased. Large increase of SGPT or SGOT and a small increase in serum alkaline phosphatase indicates it's a hepatocellular damage, whereas a small increase in SGPT and SGOT and a large increase in serum alkaline phosphatase indicates a biliary obstruction. These general principles. If you know this, how to read the LFT, that will be very good for us if you know these things. The low plasma albumin is usually found in severe liver damage, and a falling concentration is a bad prognostic sign when there is no ascites. When there is no ascites, means there is no free fluid present in the peritoneal cavity, and patient is not losing the albumin over there. Still, if plasma albumin levels are going down and it is a falling concentration, it's a bad prognostic sign. The patient is sinking. Similarly, hyperglobulinemia and hypoalbuminemia is an indicator of chronic liver disease. In all chronic liver disease, there are many alcoholic hepatitis or even alcoholic liver disease or chronic liver disease where there is early cirrhosis or even cirrhosis. Usually, the globulin levels will be serum globulin level will be high and albumin level will be low. And it is one of the important indicators for us also to understand whether our treatment is going in the right direction or not in case of KUMBHA KAMALA or cirrhosis or pre-cirrhotic conditions. So after the treatment is initiated, if these changes are observed in the LFT, that albumin is started increasing and the globulin started decreasing, then it is a clear-cut sign of that our drugs are working and the patient is regaining the things. An increased prothrombin time indicates a severe liver damage, and increasing value is a bad prognostic sign. So we always go for the serum prothrombin time, which should be somewhere around 13 to 14 seconds. If it is increased, then it is a bad thing. But on every successive time when we read it, go for a new investigations, every time its value is increasing, then it is a bad prognostic sign. That is, patient is sinking. If that is it is coming back or it is reversing, then it is a good sign that the drugs are working. In hepatocellular jaundice, the unconjugated and conjugated bilirubin concentrations are usually increased than the normal. So it's very common. If it hepatocellular jaundice, common viral infections, usually both unconjugated and conjugated, that is direct and indirect bilirubin, both will be increased than the normal. Then we have certain important and very rare conditions like serum ferritin concentration is important to diagnose the hemochromatosis. Serum ceruloplasmin concentration is used to diagnose Wilson disease, and serum copper concentration once again in Wilson disease, certain things which very rarely we get. Then another important nowadays very commonly we see is alpha fetoprotein. This alpha fetoprotein is usually by the fetal liver, it will be there, and once we start growing up from the childhood, its level reaches to a very low level. So in adulthood, usually this alpha fetoprotein will not be in the higher range. But once again, a reappearance of this alpha fetoprotein in our LFT, blood test, when we go for serum AFP, then if it is increasing and its concentration is increasing on every successive studies, then it is a clear-cut case of hepatocellular carcinoma. It suggests that we need to go for further studies and even the evaluation. In Ayurveda, differentiate between Shakashita and Koshakashita is said to be as Tilapista Nivayastu Varchaha, as in Shakashita Kamala. So it may be, it's suggested that where there is Tilapista, typically a pro-pitta type of treatment, in order to overcome this obstacle, or the sangha needs to be removed by using Tikshna Ushna Dravyas like Sharas. And once that is happens, then once again the stool color becomes yellow, then we will go for the anti-pitta treatment, what we usually do it in case of Kamala. That's what we know, that for that purpose only, we need to differentiate these two. In any Kamala patient, if develops changes in his personality, emotions, inability to concentrate, confusion, disorientation, drowsiness, convulsions is indicating that patient is developing to Halimaka, that is hepatic encephalopathy or fulminant hepatic failure. This is a very, very dangerous condition. This person needs to be treated at IPD level as well as even with all modern support of ICUs and something. Otherwise, patient any time may die. So that needs to be taken care. Whenever a patient of KAMALA develops, there is a confusion, stupor, disorientation, drowsiness, convulsions, it is better to ship the patient to higher centers. So KAMALA, if not treated in time properly, becomes chronic and causes hardening of the organs, that is liver, and then it is called as KUMBHA KAMALA, which is very difficult to treat, hence prognosis poor. Ayurveda very clearly says, Kalantarat Khari Bhutva Krichrasyat KUMBHA KAMALAha. So in Kalantara, the organ becomes harder, that is cirrhosis. The liver shrinks and becomes solid, harder. Otherwise, it was a very soft organ. So this needs to be reversed. This is what we do. Even the fibros can also we do it in case of KAMALA. I mean, there is a suspected cirrhosis to understand whether there is a liver has been shrunken or not. To understand that, we do such studies also. But in these cases, usually 50% of the cases where KUMBHA KAMALA has occurred, it is very difficult to treat them successfully to bring them back. Then hence the prognosis is poor when there is such conditions. If a patient of KUMBHA KAMALA develops black colored stools, so black colored stools is because of the bleeding, internal bleeding and profound edema, bleeding from the mouth, bleeding along with the defecation, severe thirst, anorexia, enlargement of the abdomen, stupor, delusion, loss of body temperature, unconsciousness, and increased difficulty to respiration and diarrhea, dies soon. So these are all the complications which may come across in these patients of KUMBHA KAMALA, and they are typically when these things are appeared in a patient of KUMBHA KAMALA, we need to be very, very careful in handling them. Prognosis: in case of Gilbert syndrome, Tubin-Johnson syndrome, Rotar syndrome, patient usually leads a normal lifespan, hence prognosis is good. So these patients, so death will not occur. So you can manage them with a certain lifestyle modifications as well as certain drugs. In case of a Crigler-Najjar syndrome type 1, prognosis is very poor. Rapid death occurs. It is usually happens in childhood only. In case of Crigler-Najjar syndrome type 2, prognosis is very comparatively better. Patient survives up to adulthood, but still it is not so typical to other diseases. So, death is certain in these cases, but it may prolong for some time. In cases of hepatorenal syndrome, that is Panaki and portal hypertension, prognosis is poor because it leads to esophageal varices, internal bleeding, and congestive gastropathy. So many complications inside. In cases of hepatic encephalopathy and fulminant hepatic failure, prognosis is poor, but 60% minor or mild signs survive with the prompt approach. In case of acute hepatitis, overall mortality is about 0.5%. In case of chronic hepatitis in aging persons having CA, half of them die within 5 years of onset, but with therapy, death rate reduces. In case of cirrhosis, prognosis is poor. In case of veno-occlusive disorders like Budd-Chiari syndrome, prognosis is very poor. So this is a very typical disease. Veno-occlusive disorder means Budd-Chiari syndrome, wherein we have hepatic veins will be occluded and it will be obliterated and there is no further connection. So leading to blockage and resulting in the entire system will be collapsing. In case of hepatoma, prognosis is poor. In case of liver abscess, death rate is up to 40%, which is due to failure to diagnose the condition. In case of cholestatic jaundice, prognosis depends on underlying cause of cholestasis and the possibility of surgical correction of the causes. In general, 3 out of 4 people who undergo liver transplant survive at least for 5 years, because ultimately when there is no medicines can clear the condition, the ultimate option is liver transplant. And usually if a successful liver transplant if happens, at least 3 out of 4 people will live up to 5 years or even more than that. Sometimes patients with chronic liver disease, cirrhosis, survived even without liver transplant for more than a decade. This is very, and they have seen the patient survived more than 20 years in this condition. But of course, after our treatment, he recovered totally. But ultimately, at the end of 20th year, he developed similar symptoms of what he has done 20 years back. Same thing, but this time we could not survive. And of course, but anyhow, with the our own medication, Ayurveda medication, was made alive for 20 years. Even though many varieties of disorders of liver have been described by, they can be broadly classified into 2 categories from the point of view of management. Whether it is medically manageable liver disorder or surgically manageable liver disorders. Medically manageable liver disorders are managed quite successfully through Ayurvedic medicine. When compared to the success rate of these liver disorders, with using our own medicines, we could able to achieve the target. Then we have to say, definitely we should say that it is successfully management through the Ayurvedic medicines. There are medically manageable liver disorders which we can handle it very effectively. So what is the principles of line of treatment? Rationale behind the selection criteria of liver disorders for the purpose of therapy must adhere to certain principles like, when a case of liver disorder comes to an Ayurvedic practitioner, he needs to confirm that it is medically manageable. History and clinical examination provides data for the diagnosis, but still it is better to confirm by some laboratory investigations and other imaging techniques. Then once it is confirmed, what is our treatment protocol? The commonest clinical feature in any liver disorder is the jaundice or the yellowishness. In Ayurveda also it is described as KAMALA. The basic line of treatment in KAMALA in Ayurveda is as follows. It is Samshodhyo Mrudubhistiktahi Kamalitu Virechanehi Tabhyam Samshuddha Kostabhyam Patyannani Dapayet Shalinam Yasa Yavagu Goduman Puranat Yusha Samithan Mudga Adaki Masurescha Jangalescha Rasairitam Yata Dosham Vishistamcha Yatair Baishajam Acharet. Very typical line of things, and which is typically we manage it as per these descriptions. In our hospital, we have seen typically we go for a mild samshodhana with Mrudubhi Dravyas and Nitya Virechana type of concepts, and after that Kosa Samshodhana with Patyanna in the form of dal and even yavagus and yushas. As well, of course, in case of a non-vegetarian patient, even Jangala Mamsa Rasas, something like that. So we all maintain this, and typically it sounds good and results are shown convincing that what our acharyas have said, it is pratyaksha even today. So other line of treatment, what we usually use it, Kamalyantu Pittagnam Panduroga Virodhiyat. So generally whatever we take it as a treatment line of for the Kamala, it should be always which is treating like a Pandurogi. So it generally includes anti-pitta approach, internal oleation, that is Abhyantara Snehana. Many times it is observed that, and even people say that in Kamala it should not be given the ghee and these things should not be given and all those things. It doesn't cause any much problem. We can use a minimum of ghee and Abhyantara Snehapana and subject it for Virechana also. Then also it will be sufficiently cleared, and systems becomes very clean and neat, and it readily absorbs the medicines whatever we give later. Then Shamana by hepatoprotective and formulations or drugs. The line of approach is valid for Bahupitta Kamala. That's what till now what we discussed. The line of approach is valid for Bahupitta Kamala. But whereas in Shakashita Kamala, the Ayurveda explained very typically the obstructive jaundice or intrahepatic nature, wherein treatment approach slightly changes. First, instead of anti-pitta approach, we go for pro-pitta measures to be done. And once the stool color changes to normal from clay color to yellow color, later the same treatment modality is followed as case of Bahupitta Kamala. So this is the one. Then Virechana in case of liver disorder is usually good, provided there is hyperbilirubinemia, ascites, and no obstruction to the path of bile flow. So see, without understanding these points, if somebody straight away, if a patient is having yellow colored in the eyes, it is considered as Kamala, we'll go for Virechana. Then we may land in trouble. We need to be very careful in handling these things. Virechana can be selected. To selection of that Virechana, we need to have certain criteria and laboratory investigations as well as the imaging techniques. We come for ourselves that there is a hyperbilirubinemia, the high bilirubin content. Then there is ascites and obstruction to the path of bile flow is not there. If we assure ourselves that this is a true, it can clears all these criteria, then definitely Virechana will do very good in this condition. Virechana not only helps to eliminate the excess bilirubin from the system, it also eliminates to a great extent the biochemical neurotoxins, mainly of nitrogenous substances produced in the gut by the bacterial action, which are normally metabolized by healthy liver, which are considered to be causative agents of hepatic encephalopathy. So this is what I said in the very beginning, why Virechana has to be given. People may think that what is the use of it and those things. So this is a technical explanation given to that. One of the technical explanation that if Virechana is done, it not only eliminates the excess bilirubin through the adobhaga, it also eliminates such a material which are nitrogenous substances produced by the bacterial action in the gut, and they are very toxic to the brain. And this will usually normal process also it happens, but liver is healthy, then it will block all these nitrogenous metabolic materials, all these things from the healthy liver. Mercaptan and such other things are there which are being blocked by the liver. So hence there will be these causative factors for the hepatic encephalopathy will be blocked by healthy liver. But when liver is not healthy and it is unable to control these things, then these nitrogenous material will run through the hepatic circulation and then moves toward the systemic circulation, reaches the brain, and which is the main reason for hepatic encephalopathy. So that is the reason, in order to avoid a patient of KAMALA or KUMBHA KAMALA reaching to hepatic encephalopathy, it is better to go for the Virechana. Once if Virechana is done, then this hepatic encephalopathy can be avoided. Then we have got plenty of drugs in Ayurveda which can be used for liver disorders like Kumari, Kalamega, Kasni, Brungaraja, Bhumyamlaki, Katuki, Pippali, Haridra, Sharapunka, Guduchi, Nimba, Vasa, Darwaridra, Punarnava, Mulaka, Haritaki, plenty, Kakamachi, Aranajiraka, Indravaruni, Yerenda, Kampilaka, Danti, Dravanti, Trivrut, Kiratikta, Kokilaksha, Chitraka, Jimutaka, Dugdaparni, Aragvada, Patola, Kantakari, Revanchini, Rohitaka. It's only glimpses. There are still many drugs are there in our Materia Medica. So these are some of the important plants. That is Punarnava, Guduchi, Pippali, Brungaraja, Bhumyamlaki, Kalamega, Kakamachi, Sharapunka. So some of the things I just highlighted here. Vasa, Kumari, Kokilaksha, Nimba. So what are the arbomineral preparations available for the usage of liver disorders at our dispensaries? We have got plenty of things from our text like Arogyavardhini, Kamila Araras, Navayasa Loha, Punarnava Mandura, Swarnamalini Vasanta, Tapyadi Loha, Lokanath Rasa, Datri Loha, Yakrit Plihari Loha. Then we have got Gritha and Rasayanas used in the liver disorders. Panchagavya Gritha. Am I audible? There is some disturbance?
Yes, sir, you are audible, sir.
There is some disturbance?
No, sir, it's okay. Going fine.
Someone's mic is on. So we have got certain Grithas and Rasayanas used in the liver disorders. There are Panchagavya Gritha, Mahatikta Gritha, Shatavariyadi Gritha, Kalyanaka Gritha, Draksha Gritha, Haridradi Gritha, Panchatikta Gritha, Indukanta Gritha, Brahma Rasayana, Gomutra Haritaki. So that depends on the criteria where we can use them. Certain times we may use them after the completion of our therapy in order to make him balista, or we make the balya to bring back the bala. We can use these things. So what may be the actions, mechanism of action of Ayurvedic drugs formulations? Many times for our Ayurvedic doctors or people who present any topic on these liver disorders, the scientific community or so-called the modern medical people, they will always question how your drugs work. Do you have any idea? So then we'll be in a typically either we have to say our Ayurvedic Rasaguna Virupaka and how it will going to work and doshas and everything. But sometimes he may not be in a position to understand that. So in order to shut their mouth, these are the things we need to understand that our drugs work in these all ways. Like they are hepatoprotective action, they have got antiviral action, they have got cholinergic action, they have got the regeneration of hepatocytes action, anti-fibrotic action, appetite stimulation, laxative action, antioxidant action, and immunomodulatory action. These are all the activities that are required to make a to come back to normalcy. So all our drugs at one or the other level acts in this way. There are trusted my medicines. Usually I use it. These are the 4 kashayas: Patolakatruvanadi kashaya, Nimbamritadi kashaya, Vasa Guruchari kashaya, and Bonimbadi kashaya. Along with that, I got another one, Pitta Recha kashaya is there, which usually I go with selection depending upon the bilirubin levels. And of course, all these kashayas are very bitter in taste, and that's the one important problem in Ayurvedic medication, that is a palatability. So in order to make it a palatable one, then I go for mixing with the Livact, that is a syrup, which also has liver stimulating materials, but it is a syrup base, and it is going to help us in avoiding the taste to a certain extent. Similarly, we have got in these patients of KAMALA and KAMALA also to some extent. Then there is a low hemoglobin. So in order to improve the hemoglobin, we use the pentaferrol syrup, which is also a combination of draksha, dadima, and even the nanoparticles of iron. So present in that lohabasma. So all the once again, this also syrup is in sweet form. So we use these combination to mask the bitter taste of the kashayas. Then otherwise, then we have got Livac capsules. Then Purelax capsule, which is a very good bowel cleanser, and usually I use because this capsule will give usually 2 to 4 times a day bowel evacuation, including a watery and as well as natural. Then we have got Arogyavardhini Ras and Pitta Recha Kashaya. Very prominently, these things work. And this in Arogyavardhini, we have got such a classical way we have prepared it. And our Arogyavardhini tablets are also very minute in nature. It has a 165 mg of active ingredients. Hence, our dosage is we fix it to very typically only 101, not more than that, because that is enough to bring about the result. So then we are not loading the system.
Sir, your voice has got muted. Kindly unmute yourself.
Your sound is not coming.
Respected participants and the gurus,
बहुत
I have
सुंदर व्याख्यान है सर,
collected
आपका बड़ा सुंदर व्याख्यान रहा। आवाज आ रही है आपकी, नहीं आ रही?
मैंने बात किया है सर गुरुराजा सर से कि माइक में कुछ इशू हुआ है, तो वो
कोई बात
अभी जो है वो दोबारा चेक करेंगे। आई थिंक अब हो गया है।
वैसे काफी ने बता दिया सुंदर, लेकिन ये तो अपना नुस्खा बता देते कोई जो खास स्पेशल हो, जिससे इतने सारे ग्रह थे लोग इतना यूज नहीं कर सकते ना।
सर केस स्टडीज आएंगे सर अब।
No sound, no sound.
इट इज
आवाज आ रही है मेरा?
ऑडिबल सर, ऑडिबल ऑडिबल।
आ रही है
आवाज आ रहा है मेरा?
यस सर, प्लीज कंटिन्यू सर, इट्स ऑडिबल।
स्लाइड्स पे दिख रहे हैं?
Yes, sir, it's visible, sir. Screen is visible.
Okay. So this is case number 1. You can observe that a 30-year-old male as an alcoholic person came to me with these findings, and he was actually suggested to go to higher center, and then because of that reason he has came to me, and you can observe there on 20th 5 2011 his bilirubin level was 9.85. So then we taken a medicine from some allopathic doctor there. Then on the 22nd, once again they rechecked it, we increased to 12.08. Then they suggested to go to Manipal, a nearby place where it's very common. Many of the higher patient for higher center, we send it for Manipal. So he came to me with that report. After that, I evaluated it and started my treatment. So it started reducing to 9.3 by the month of June. So it started with 1 month time. Then later, even hemoglobin started increasing. You can observe there by the end of June, that is a 2 months time, his bilirubin level came down to 4.5. And even ascites was there, minimal ascites, even that reduced and hemoglobin increased. Bilirubin level came to almost normalcy. You can see that hemoglobin has increased to 11.2. Prothrombin time became normal and entire range of LFT became normal. And this happened by the end of 6 months. So it is an alcoholic cirrhosis or hepatitis patient. Early cirrhosis is totally converted and made clear. And this fellow is still alive and doing good. So this is another second case. You can observe there. This patient has gone to Manipal, usually common place. On 8/1/2021, serum total bilirubin was 26.89 mg per deciliter. Then after the treatment, within 15 days, so this came down to 5.2. But still HP percentage is very low, 7.6 grams. And by the end of 1 month, you can observe there is no ascites. Previously it was ascites, and now there is no ascites. And after 30 days, you can observe hemoglobin is started increasing and prothrombin time came to normalcy. Then once again, after 30 days, you observe that bilirubin levels also came down. After 65 days of treatment, bilirubin levels came down to 1.8 mg per dl. And hemoglobin increased to 11.2 grams after 65 days of treatment. After 100 days of treatment, LFT reached total normalcy and continues to remain in the normal limits as on date. Till today, she is doing good, wonderful, no problem. Even hemoglobin further increased. You can see that 12.3. And there is no ascites. Even liver abnormality has been gone down drastically. So this is the case. You can see when she came with a protruded abdomen. Of course, she is a laborer, addicted for alcohol consumption, landed in trouble. Then she reached to us. You can see the change, the abdominal girth and protrusion. When the stretchings have come down, and you can see the change in the eyes. This is another case. It's once again chronic liver disease. Total bilirubin was 18 mg per deciliter. And by the end of 30 days, it came down to 3 mg. And even the same case, you can observe the Padashota at the day 1. And you can observe the Padashota at the day 30. It has started reducing and even wrinkles could be made out. Another case, you can see there, serum total bilirubin is 18.83 and SGOT, SGPT is 860 and 770. And after the treatment, it came down to 2.5 and SGPT, SGOT 115 and 31.9. In the case, you can observe there changes. You can observe the belly changes, protrusion, abdomen. You can see that the changes. This is another case. Once again, a female. Once again, a laborer. Non-alcoholic. This is another case. You can observe the change with our treatment. This fellow has also gone to the AGM Institute of Medical Sciences, Mangalore. When he came, his total bilirubin was 12.9 and the prothrombin time was 32.5 seconds. Then it reduced to 4.38 and the prothrombin time reduced to 21.7 seconds. Another case you can see, but it is a non-alcoholic cirrhosis. Exact reason for this cirrhosis is not known, and this is also not cancerous one. It is not hepatocellular carcinoma, but the reason was unknown. You can see the change. It's a case of once again Ekrutalodara with the results of Nitya Vilechana and Dugdapana. Another case you can observe total bilirubin is 20.4 mg per dl, and after treatment it came down to 2.82 mg per dl within 15 days of time. You can observe the change after 60 days of treatment. It's another case. You can observe bilirubin levels. Even hemoglobin and prothrombin time you can observe. Hemoglobin level increased to 13.2 grams from 8 and prothrombin time came down to 15.7 seconds. It's another case, a young boy in its 24 years, 25 years age, alcoholic in nature. Another case, you can see there, result of Nitya Vilechana and Dugdapana initially, along with that our medications. You can appreciate the distension of abdomen which has been reduced. You can observe the prothrombin time. It was 27.2 seconds. It is reduced to 18.6. Hemoglobin is also slowly increasing and bilirubin has become normalcy. You can observe there total normalcy. Usually I do whenever there is a excess of peritoneal fluid, free fluid, and patient is having difficulty in anything, then we'll go for the paracentesis of the abdomen. Usually 2 to 4 liters or 5 liters of fluid will be removed by Udara Jala Nishkasana techniques. You can see there are many cases of such very protruding and highly tensed abdomens. Then in order to avoid the congestion and pressure on the lungs, we need to go for removal this. Otherwise, it will have a, from the abdominal thing via the diaphragm, it penetrates even to the pleura and becomes a pleural effusion later on. You can see such a big things, abdomen, belly. The medications used in these cases of early cirrhosis, pre-cirrhotic condition, or cirrhosis of liver, KUMBHA KAMALA, the general combination usually like this: Pitta-Rechaka Kvata 10 ml thrice a day after food, Arogyavardhini 101 after food, Livact 202 after food, Pipali Churna 1 teaspoon with milk twice a day, then capsule Purilax 001 for the purpose of Nitya Vilechana, then syrup Pentaferol 10 ml twice or thrice a day after the food as per the requirement of with respect to hemoglobin enhancement. These are the ascitic fluid and cirrhosis material in case of cirrhosis. Even sometimes 4.5 liters are removed. I removed 3 liters or something like that. It will be straw yellow colored. And it is a typical thing for just confirmation that it is cirrhosis. Otherwise, if it is a cancerous one, it will be bloody. Or even chyle, if it is there, then it becomes whitish. So these are the viral hepatitis cases. You can see there, acute viral hepatitis. We had 2 episodes in last 3 years. Outbreak of hepatitis A in our city. There are plenty of patients with this, and we are successfully managed them through Ayurveda medication. You can see there is a clear-cut change. You can observe serum bilirubin was at 29.6 mg per dl before the treatment, and it after 45 days of the treatment, it came down to 2.2 mg per dl. You can see another case. Bilirubin levels are 45.74 mg per dl before the treatment, and it is a very latest case, and it is still under treatment. Now, after the 60 days of treatment, now it is 4.06 mg per dl. So it's still under treatment now, this case. You can observe that color. You can observe another case of viral hepatitis. Bilirubin levels are 7, SG40 is 309, SGPT is 173, and alkaline phosphate is 455. It's a very severe inflammation of the hepatocytes. That's why you can observe alkaline phosphate is multifold increase. Then after the treatment, it reduced to 1.6. When alkaline phosphate started reducing it. What are the medicines which I use in the hepatitis A or the KAMALA or jaundice? What are the generally we call it as? It is usually if it is a viral origin, and then depending upon the condition, body nature, and all those things, Pitta Rechak Vata or Patola Katruanyadi Kashaya, Vasa Gudichari Kashaya or Bunimbadi Kashaya is used. 10 ml thrice a day after food. Arogyavardhini 101 after food. Cap Livac 202 after food. Then Bhumi Amalaki Kanavati 111 after food. Tablet Guduchi Kanavati 111 after food. And in order to improve the taste, we can use even Livac, because we have got even the very young children suffering from hepatitis A. So in them, even though we don't give in the same fashion, this is the adult dosage what I have described here. We are given the serum Livac. So this is an acute case of hepatitis B. As one of our nursing student, she suffered from the hepatitis B, and she has been given treatment within 3 months. Even hepatitis B surface antigen become negative, and even LFT becomes normal, and even yellowishness is gone. Jaundice is completely reversed. This is another case of viral hepatitis. It is also a case of chronic hepatitis B. There is a change after the treatment. What are the medicines used in the hepatitis B infections are? Usually Pitta Rechak Vata or Nimbamritadi Kashaya, Arogyavardhini, Livac, Bhumi Amalaki, and Immunup capsules in order to improve the immunity, and which contains some portions of Indukanta Grita and some portion of Pipali Grita in that. So with this, I would like to conclude that Ayurveda is an evidence-based ancient medicine, proving its authenticity in the management of KAMALA and KUMBHA with special reference to liver disorders, even today, with its proven and documented hepatoprotective drugs and fundamental principles. Thank you.
Thank you so much, sir. I would request if somebody of us have the doubts, you can ask or you can put the doubts in the chat box. On the behalf of RSP, I would request you to summarize some of the drugs or medicines in general, in all the cases you have presented, that which preparations can be used.
Very clearly, there are 5 varieties of kashayas. Either one of the kashaya, depending upon the condition, we use it. It may be very clearly, it may be Pitta Rechak Vata, which is an advanced preparation or a modified preparation, and over the Kashayam, and we have got Amritadi, but in my practice, commonest is either Pittareja Kwata or Patolakatruanyadi Kashaya. I use it. In most of the Kamala cases, it may be Kumbha Kamala or even the Kamala, viral hepatitis. Then Arogyavardhini at a dose of 101, it's very common one. Then the capsule, Livact, which is also a dried powder extract of Patolakatruanyadi Kashaya. If it is can be used, then I'll use it for dosage depending upon the body weight of the plant, maybe 2:2, 202 or 111, depends. And then is the ascites condition, then Nitya Virechana has to be done. And for that Nitya Virechana purpose, I usually go with the Purilax capsule, which is containing Jayapala in it, a purified Jayapala, which gives usually 2 to 4 times bowel evacuation. And along with that, if it is required, I'll go for even liver protective mechanism materials like, for example, sometimes even along with that, spleen is also involved. Hepatomegaly with splenomegaly. In that condition, we'll go for Lokanatha Rasa as a combination. So these are based on the content and when they're presenting complaints, as well as our observation and the details from the history, we'll plan things. So with these developed modified dosage forms from our company, we are using it in a different conditions with the success rate is so high, and we have documented it since last 10 years.
Thank you so much, sir. Do we advise any Patya during this treatment to the patients?
Definitely, Patya is a very must. In any disease of Ayurveda, by treating through Ayurveda, Patya is a must. Usually, I go for a Patya in such and that I will avoid all the non-vegetarian diets first in the beginning, even for the non-vegetarians. Once their Agni improves, then I allow them to go for a little bit of chicken soup if it is for them, non-vegetarians. But in case of vegetarians, it is purely a veg diet, dal and all those things, which is supacha in nature, easily digestible, one will be given. In order to maintain the particularly the protein values inside the body, because it's a protein losing enteropathy, we need to give proteins. So here I will go for usually milk, the cow milk, because Ayurveda says about giving a Ustri Dugdha, but in my place availability of Ustri Dugdha is not possible. Hence we'll go for the next option is cow milk. So I ask them the patient to take cow milk up to 1 to 2 liters per day in a minimal intervals continuously as a primary food. Based after that, still if you feel hungry, then you can allow to go for the dal khichdi or something like that. So then along with that, I'll make them to avoid all the roadside foods, as well as even I ask them to drink boiled water, and everything will be boiled. No question of raw material, anything raw can be used. Avoiding all the in case of viral hepatitis. So such care is taken.
Okay, sir. Do we have any other question?
Sir, I have a question. Can we manage hepatitis C also?
जी सर, हेपेटाइटिस सी को भी हेपेटाइटिस बी जैसे ही कुछ व्यवस्था पत्र बनाना है, उसका वही कॉम्प्लिकेशंस वगैरह देख के मैनेज कर सकते हैं. उसका मेरे पास अभी 2 केसेस है ऐसा जो हेपेटाइटिस सी का भी मैनेज हुआ है. दे आर सर्वाइविंग विद दैट, बट स्टिल वो नेगेटिव नहीं हुआ अभी तक. हेपेटाइटिस सी नेगेटिव नहीं हुआ, लेकिन कॉम्प्लिकेशंस तो नहीं है.
ओके, थैंक यू सर.
इसमें डॉक्टर साहब रोहित का रिस्ट की भूमिका कितनी है? रोहित का रिस्ट की
कर सकते हैं सर, रोहित का रिस्ट पे यूज कर सकते हैं, लेकिन यहाँ पर हम लोग कॉम्बिनेशन से बनाते हैं ना, मैं यही यूज करता हूँ, उसी को बताया. लेकिन अगर अवेलेबिलिटी के हिसाब से बहुत सारे दवाई है, वही तो मैंने बताया था ना, बहुत सारी दवाई आयुर्वेद के मटेरियल मेडिका में है, हम किसी का भी कॉम्बिनेशन सेलेक्टिवली कर सकते हैं. जो मैं यहाँ कर रहा हूँ उसका मैंने बताया था, लेकिन रोहित का रिस्ट का भी रोल है. डेफिनेटली रोहित का रिस्ट का कर सकते हैं, यूज कर सकते हैं.
बहुत बहुत धन्यवाद डॉक्टर साहब, बहुत सुंदर प्रेरणादायक आपका उद्बोधन रहा और हम सभी लोग और शिष्य बॉय जो है इससे प्रभावित रहे आपके व्याख्यान से। और कुछ ऐसे कुछ नुस्खे हैं डॉक्टर साहब जो सटीक दिए जा सके, क्योंकि बहुत सारे घी बताए आपने, बहुत सारे, कोई ऐसा हो जो संक्षेप में हो जिसको दिया जा सके, हाँ प्रिपेयर कर सके, क्वाथ को घर से कुटकी है, काल में है, ब्राह्मी है, कुछ ऐसा मिला करके दे सकते हैं इसको घर से क्वाथ बना करके, कोई आपने दिया ऐसा?
अगर देना है तो कर सकते हैं सर, लेकिन नहीं मैं ऐसे, क्योंकि मैं ऐसे बनाने की कोशिश नहीं करता, क्योंकि मेरा जो भी है मेरा फैक्ट्री में बोल देता हूँ तो वो बना के देते हैं। और आप ऑलरेडी हमारे पास इसका हिंदुकांत घृत है, पिपल्यादि घृत है, और इन दोनों का मिला के वह इम्यूनअप कैप्सूल है जो भी अवेलेबल है, इसी को हम यूज कर लेते हैं। जो इसीलिए नया कुछ बनाने की कोशिश नहीं कर रहे हैं मुझसे। खुद मेरे यहाँ सिस्टम इसमें बना के कुछ प्रैक्टिस करने का ये नहीं है, प्रथा नहीं है। जो प्रोटोकॉल जो बनाया हुआ है पहले से हम उस प्रोटोकॉल पे चल रहे हैं।
अच्छा, आरोग्यवर्धनी पुनर्नवाम मंडूर अलग से देते हैं आपकी, इकट्ठा किसी क्वाथ के साथ देते हैं आरोग्यवर्धनी पुनर्नवाम मंडूर?
पुनर्नवा मंडूर कभी कभी देते हैं सर, आरोग्यवर्धिनी हर पेशेंट में देते हैं। एक उसका 2 ही टैबलेट है, सुबह एक रात को एक, खाने के बाद ही देते हैं। कषाय के साथ लेना ऐसा कोई ये नहीं है, ले भी सकते हैं, ऐसा कोई रिस्ट्रिक्शन नहीं करते उसको।
अच्छा, कुटकी का पाउडर आप अलग से देते हैं? क्वाथ के कुटकी है, काल मेघ है?
नहीं, कुटकी का पाउडर अलग से नहीं यूज कर सकता सर। मैं कुटकी ऑलरेडी आरोग्यवर्धिनी में है, और जो पित्तरेचक क्वाथ है उसमें भी कुटकी है, इसलिए एक्स्ट्रा कुटकी का पाउडर यूज नहीं कर सकते।
अच्छा अच्छा अच्छा, चलिए बहुत बहुत धन्यवाद।
Hello.
नमस्ते।
Here is one question, please. See,
Yes, sir.
according to modern system of medicine, the fats are strictly avoided in case of hepatic disorders. But how do you justify various grutas in these conditions?
The Pratyaksha Pramana is the one which is most suitable for us to explain this. Even though it is fat soluble materials are given in conditions like this, we are using in a very low dosage in the early part for the purpose of Shodhana if it is done. Otherwise, initially we don't give. Only once the Agni is improved, then followed by that we will give it. Initially also we will also avoid all these things, because this Grita, whatever it is there, it is very difficult to digest for the general population. But there is one supportive factor from Ayurveda. It is said that Grita is Vichitra Pratyarabdha Dravya, even though it is a Guru, Shita and Madura, but it is one of the important Agni Vardaka. It is even outside also, if you put Agni in Grita to the fire, it engulfs the fire in more quantity. So that's why it also enhances the fire inside the body. So it is Agni.
See,
Definitely we are here in Kamala disorder. Agni is disturbed. In order to improve the Agni, we can give Grita to small doses that will help it.
100. What I mean to say, according to Ayurveda and for Ayurvedic people, it is easy to explain. But what about when we come across our counter people, then how do we explain this?
So that's the reason I explained this, because they don't know about the quality of Giri as per Ayurvedic principles. According to Ayurveda, it is a Vichitra Pratyarabdha Dravya, which is, even though Guru Snigdha Shita Madura, it acts as Agni Vardaka. Very typically, it enhances the Agni inside the body, even outside the body. That's the reason we give it when there is Agni Nasha in case of Kamala Vikaras. So it can be given, but it is given in a small doses till Agni can give it. And today we are doing it in Pratyaksha, and Pratyaksha Pramana is a more satisfying thing rather than any explanation.
Okay, but still, that is what I am saying. We can explain and we can satisfy Ayurvedic people, and Ayurvedic people use, and Ayurvedic texts have very much suggested this various grutas and snehana even in sometimes and even initial this also. So the thing, this is a very they are very deadly against using the fats and particularly saturated fats. So here, just my personal experience, I myself suffered a long back with Kamala. So whenever because of the advice of he was also very repeated Ayurvedic physician I was taking from my guru. But he also like integrated the Ayurvedic physician. So I was kept on a fatty-free diet. But as long as I was taking fatty-free diet, I used to pass the bilirubin in the urine and some slightly raised bilirubins. But I vexed up after 3 months. Then I have started taking Gruta. Immediately it stopped. Immediately the serum bilirubin levels and the urine was free from bilirubin, the urobilirubin. So this is it is a very scientific, but they are unable to explain. Probably that now I am unable to explain. It will be time consuming. So the according to Ayurveda, it is very nice and it is very scientific to use grutas in hepatic disorders. So the thing is they are deadly against. And we people talk about evidence-based. Of course, we are producing evidence, but how it is happening, that is important. Okay, thank you very much. Just I wanted to share my experience with you.
So our acharyas have very clearly suggested in the previous also, Rinam Kritva Gritam Pibet. You just go and lend the money from somebody and take the Grita and drink it, because it is so very clearly said, Rinam Kritva Gritam Pibet. Grita has its own importance. See, regarding this Grita, there are scientific studies done by Belgium people. A lot of studies are there. But unfortunately, these people are not noticing it very clearly. They also said that it is saturated fat and also say it's going to increase the cholesterol in the body. But we have studied even that case, given Grita of Ayurveda before Shodhana, taken for the lipid profile examination, and after the examination, rather than increasing the cholesterol, the all lipid parameters have come down. So it is a very wrong statement to say that saturated fats and everything will behave in this fashion. And the modern medicine people is that one typical thing is that till today what they are promoting as a science. If next day something comes as a new thing, they will ditch the old one and catch the new one. So don't worry about their convincing them, sir. It is our duty to do it, and practically we are doing it. Pratyaksha Pramana is giving result and patients are also getting convinced. And that's why, even though they are propagating in such a manner that ghee should not be used, it is cholesterol and all those things, till the ghee rate is increased. Around pure ghee is around 700 rupees per kg. And if you go to A2 milk and production the ghee, it is 2000 rupees per kg. So the value will remain, sir. The truth everybody knows, but due to certain factor and certain reasons, they will mask it. So we don't want to worry about that. Our Ayurveda principles are very clearly, and they are time tested, and it is difficult. Very typically, we use them in our practice, of course, with the scientific logic and even the Ayurvedic principles.
Okay, thank you so much.
Thank you, sir. We have a doubt in chat box. What other rasaushadhis can be used in this Kamala and KUMBHA patient, a part of AYURVEDA?
What is the question?
Are the use of rasaushadhis justified in Kamala and KUMBHA? And if yes, then what else apart of Arogyavardhini rasaushadhi we can be using in Kamala?
I have already given the list. It is justified and we are using it. We are using Arogyavardhini, and whenever there is typically there is a splenomegaly, I am using even Lokanatha Rasa, even Punarnav Mandura. All these things are used, and it is justified. People, they don't know about the nanoparticles. When they come with the nanomedicine, then we try to follow them. But Ayurveda has given in the long back the Rasaushadhas. They are nothing but the nanomedicines. We are having plenty of nanomedicines and its role. So we need to. Even in Rashastra also, there are plenty of medicines are there. If you follow typically what they are said in the text, if you follow it and do it, all our preparation ends in nanoparticle size. We have done a complete study of that also. Russia Aspirate division. We have got more than 40 preparations in our company. We got already studied all these things, even the base drugs. Once it is reached to the final stage, we have sent it for the Tata Nanoscience Technology Institute. They have given the base study of that and very clearly suggested it is all in nanoparticle size. So those drugs which in nanoparticle size definitely do wonders. We should know how to do it and what way to do it.
तो एक ऊपर मैं लगाऊं तो देख ऊपर धर तो मैं धो गए तो यार.
Okay, thank you so much, sir. On behalf of the organizing committee, I would like to thank Dr. M.B. Gururaja, sir, for delivering such insightful lecture and sharing his clinical experiences and presentation with us. I would like to extend my sincere gratitude to our mentor, Vedya Devendra Trigunaji, sir, President Governing Body Member of RAV, for his continuous support, guidance, and blessings. I also thank our Director, Ma'am, Dr. Vandana Siroha, who is the guiding force of the events. I would also like to thank Secretary Sam Vedya Dr. Rajesh Kotecha, Ministry of Ayush, for his participation and encouragement in all our endeavors. With this, I would like to request all our CRAV gurus, as we mailed also, for providing the tentative dates so that we can schedule our lectures in the upcoming series. Also, I request all CRAV gurus to encourage their students to be indulged or engage more in the doubt session, as Director Ma'am was asking that why the students are not getting involved in this. Also, during this session, I am getting that if the students are willing to have the PDF or presentation or anything else like in document, then they have to show the interest that yes, they are working on it. They are having the assignments. They are asking the questions. The topics have been already dispersed in the flyer, which is going to be studied or during the lecture, our speaker or our expert will be delivering. So what students should do, they should also have do some homework or some pre-work. They should also study the topic so that they can have more acquaintance towards the topic. Right, so I would like to request our respected CRV gurus to kindly motivate your students, kindly guide them to have more questions, more queries during the session, after the session, or even we can have the discussion also regarding this. Thank you so much. Next lecture will be on next Thursday by Dr. N. Devendra Pujari, sir, on Shad Kriyaka, as I already mentioned. Thank you so much, sir. Thank you everyone for being the part of this. Thank you.
Thank you for giving me opportunity to share my thoughts. Thank you.
Thank you.